In high school athletes, sudden cardiac arrest is the #1 cause of death. Statistics on how prevalent it actually is vary greatly. Depending on the research, it ranges from 1 in 40,000 to 1 in 80,000. So how concerned should parents really be? Can they do anything to prevent it? And what about your child's school? What should they be doing to protect your child's life? Joining me live, Dr. Adam Keene. He's a cardiologist and an electrophysiologist at Raleigh Children's Health. So good to see you. We've had a couple of parents lately. They've been on the show, one in particular that was very emotional and really connected with our audience. And it wanted us to talk more about this very rare occurrence, but we do see mainly young men, young boys that are having issues. I want to kind of just start with a big picture. We don't want to scare parents here because it is rare, but what do you want people to know?
I think I'd start out exactly how you mentioned. This is an incredibly rare phenomenon, but that doesn't by any way mean to minimize it. When it does strike, it's devastating, of course, to the family, but also the entire community. We're talking about kids who are in the prime of their life cut short, and we're still talking about 2,000 kids in the U.S. every year.
2,000, when you put it that way, even though when you know it's so rare, we hear SCA, and we're like, okay, well, what is SCA? What is it? What causes it? Do we even know, or are there a lot of different things that cause it?
Yeah, so the two primary causes are going to be either relative to the structure and function of the heart muscle itself, or the way that the heart rhythm is propagated, meaning that if there is either something that the heart is born with, that is a congenital problem, or an infection, that can cause the heart to act in a way that can not allow the blood to flow properly.
So when you try to, when those viewers are watching this morning and this question that's in there, how concerned should a parent be? Is it more of just the information that they have and that they know? If you have a family history, or if your child has been experiencing something on the field, is that maybe kind of where we want to look to say, okay, maybe then you should look further?
And I would say without a doubt, most importantly, every student deserves a primary care evaluation that is really gold standard to root through some of these concerns. If there are concerns, then moving forward to other diagnostic tests such as rhythm analysis as well as structure and functional analysis are reasonable. If there are no concerns, however, and this is a controversial topic, whether we need to sideline kids prior to being testing is a tricky thing.
Yeah, I want to move to this because I know you guys have partnered with Project Adam, providing CPR and AED and other resources to schools around Indiana. Tell us a little bit about why and why you think that's so important.
The reason this is so important is because despite our best efforts, there are going to be, it's not a question of if, it's not going to be a question of if, but when these events happen in school, and we need to be prepared. So it's what I like to think of creating pre-responders. If we have a school full of pre-responders, it makes it so that our first responders, when they come to the school, have a chance of being that much more effective in resuscitating these kiddos.
Every high school kid has to have a physical on file. A lot of the physicals kind of just, you go talk to someone, you show, is there something that we need to know ahead of time that you say, okay, when you're going in for this physical, here are the things that you should be doing or asking specifically?
Yeah, so actually the American Academy of Pediatrics just reviewed all of this within the past 12 months, and it's not just a 12 question and history and physical section. There are actually 4 new questions that deal specifically with family history, as well as symptoms like palpitations and chest pain and unexplained passing out that get to the root, that if there are any of those concerns, then more evaluation is definitely
4 new questions that could mean all the difference, and then what you all are doing, making sure there are defibrillators and people know how to do CPR. Thank you, Doctor. We appreciate you. If you'd like more information on Project Adam Indiana, fox59.com/links.